Good afternoon. I'm Debra Moore. I'm the editor of the local newspaper and plumasnews.com. And I'm here today with three people who are intimately involved with responding to coronavirus here in Plumas County. And I've had the privilege of working with all three of them since March when this all started to happen. But today's a day for celebration. We got the first Pfizer vaccines in the county. And so I'm here with Andrew Woodruff, who's the public health director, Dr. Jeff Kepple, who is our local doctor and also a North Cal EMS medical director, and then our public health officer, Dr. Mark Satterfield. And we're going to start off at the end of this little interview that we're going to conduct. You're going to see Dr. Satterfield and Dr. Kepple get the first vaccines administered here in Plumas County. We're going to start off with Andrew Woodruff, our public health director, and he's going to tell us how the Pfizer vaccine arrived here in Plumas County and just exactly the course it took to get here. Andrew, would you like to tell us how the vaccine arrived today?
Thank you, Deborah. And first of all, I just want to mention what an honor and a privilege it is to work in Plumas County and be a part of how the vaccine is going to make its way through our community as a first step in exiting this pandemic. So today is a momentous day, as Deborah mentioned. Two of our public health staff, our nursing director and our public information officer, drove to Mercy Medical in Shasta County this morning to pick up 195 doses of the Pfizer vaccine. And those were then transported and delivered within Plumas County to each of our three critical access hospitals, including Plumas District Hospital, where we sit right now. In addition to the Pfizer vaccine, Plumas County Public Health also received 200 doses of the Moderna vaccine. So folks watching might be aware that there are currently 2 vaccines now available in this country. So what's really important to know is that the CDC has been deciding on the allocations that each state gets. And then the states in turn figure out the allocations for the counties. So what we'll do as public health is continue to receive the vaccine. We will be ordering as much as we can, and of course supplies will be limited related to the speed of manufacturing of both vaccines. So right now, as I mentioned, we picked up the Pfizer vaccine in Shasta County. In the future, Plumas County Public Health will receive the Pfizer vaccine directly. Right now, we don't have the type of freezer that is required, but early in January, we're expected to receive that equipment, and Plumas County Public Health will serve as a hub for our region, such that county partners in Sierra and Lassen, for example, can pick up their allocations of the Pfizer vaccine through Plumas County. So we're very proud to serve that role in the region. So as community members might be aware, there are prioritization tiers as to who is to receive the vaccine first. Our goal is to work through the tiers as fast as possible to get the vaccine to those who are willing and ready to take it. And those prioritizations are made at the national level, and so we will be following those. The first tier, includes healthcare workers and persons who live in skilled nursing facilities and the persons that care for them and other support staff. As we work through our hospitals, we are also planning with our law enforcement and fire. One important group that is part of the first phase are our emergency responders. And so we're very excited to roll out the vaccine to all of those folks in our community as soon as we possibly can.
Okay, so Dr. Satterfield, I'm going to give you the first question because Andrew just explained how it's going to roll out in the community, but you and Dr. Kepple were the first ones to receive it today. So, or will be the first ones to receive it today. Mm-hmm. So what studies have you done that make you feel comfortable taking this vaccine?
Well, it's complicated because we're all concerned. We don't want to see any harm done to anyone with the vaccine, but it has the potential to do so much good, which most of us know. And it all centers around randomized, double-blind, placebo-controlled trials, which is the standard in the scientific world and in medicine, and they've been going on for many, many years, and that's what was expected for these vaccines. And in those trials, they're randomized so that half the people get the vaccine and half don't, and they're double blind so that no one getting the vaccine or not knows which they got, the placebo or the vaccine, and controlled. And so it takes the possibility of a placebo effect kind of out of the equation. And so when you do that, there were 44,000 people tested for the first vaccine, and so 22,000 got each type. And then they go back and they break the code so that they then know who actually got the vaccine and who didn't. But there was no bias put into the formula in terms of side effects. And so what they found was the vaccines are very safe and they're very effective at reducing the incidence of COVID. So it was very exciting findings. Determining vaccine safety and efficacy is a transparent process in the United States and in most of the world now, and it's only gotten better. So I have great confidence in that process and the results of the studies that were done.
Thank you. So this question is going to be for Dr. Kepple. You're going to take the vaccine today. Are you going to recommend it for your entire family and your friends?
Mm-hmm. I do. I recommend it for the people that I love, like my entire family. You know that I have a wife and three girls. My daughters are in that age group, 25 to 34, that's very low risk, but there have been around 3,000 deaths in the U.S. in that age group. It's not small. And in my age group, 55 to 64, and my wife's, there's been about 33,000 deaths in the United States now. Yes, a lot of those are folks that have underlying conditions, but there are definite outliers. The most important reason why I'd like myself to be vaccinated, my wife and my daughters, is to protect others. I'm not really worried that we're in a high risk tier, except that one of my daughters and I, of course, are in healthcare, and we certainly want to be very, very careful. So given that we're seeing about 3,000 deaths a day in the United States, and the second leading cause of death, heart disease, is down at around 1,900 per day, and cancer is at around 1,800 per day, this is an exciting day that I think should give us a ray of hope that we're on a path to a better 2021.
Okay, this next question is going to go to both our doctors here. And I think people are going to really be interested in what side effects do you anticipate and what you're prepared for. And just so you know, I will be checking up with you tomorrow and the next day to see how you're doing, and we'll be able to report that as well. So I'm going to start with you, Mark.
Sure. So I would divide side effects into maybe two categories. Most people that get the vaccine may have no side effects whatsoever, but then there are a list of common side effects that people get when they get the flu vaccine or any other vaccine, which will be a little soreness at the site of the vaccination, even a low-grade fever, joint and muscle aches or something of that nature, kind of almost like a flu-like syndrome. And those are self-limiting and just require simple medications to treat. There have been some reports of some rare side effects in Great Britain and in Alaska. The important thing is that they were insanely rare, and they were readily treated by common medications that are used to treat a little bit more severe allergic reactions. So nobody has had something severe happen with this. And maybe Dr. Kepple has some other information on side effects that he would share.
Sure. Well, first, it's really good to know that Debra will be checking up on us, because
I feel better.
yeah, she should go into nursing or something like that. But like Dr. Satterfield said, the common things that we would actually expect would be headache, and kind of body aches, and there's a lot of joint aches and fatigue that we see with COVID. And so some of the side effects that you would see with actual COVID are going to occur with the vaccine. And they actually are trying to get away from calling it side effect, and the new terminology is reactogenic. It's a reactogenic reaction, meaning it's actually what your body's supposed to do, in that it's showing an immune response. And they're actually finding that that's going to be a little bit higher in younger people because of their robust immune systems, and also a little bit higher on the second dose. Remember, this requires a second dose, and that's because our immune system remembers that so quickly that it jumps right on it to boost the immune response. But it's typically it's transient. 1 to 3 days is the most common. So,
Okay, thank you.
yeah.
So Dr. Satterfield, we've heard from Andrew about some of the rollout for the first tier frontline healthcare workers, but when do you think that it's going to be made available to the general public?
Well, it's going to take some time, and there's some disagreement, I've noticed. So some of us follow Anthony Fauci, and I heard him say as early as April, maybe for the public as a whole. However, that's highly dependent upon the manufacturer and supply chain considerations. If there's any hiccups in the process, it's going to be later. And most of the more conservative estimates are that late spring to summer. So we're excited about that happening, and we'll have to wait and bide our time. But I'm hoping Dr. Fauci's right, because it'll really soften the curve of the deaths and the pandemic that's going crazy in our country right now.
Well, I know the goal is to get as many people vaccinated as possible and as quickly as we can, but is there anybody who shouldn't be vaccinated?
So there's really only one group that the company says shouldn't be vaccinated based upon the current information, and that's someone who's had an anaphylactic reaction. That's a very severe allergic reaction to a vaccine made by them in the past, and so that's a tiny amount of people. But there's often questions about if a pregnant person, for example, should get the vaccine, or someone who's already had COVID. I don't know, I think you were said you might be interested in that as well. And also people, higher risk people that maybe have immune suppression for some reason or another. And basically, none of those people is it contraindicated by the evidence. So some people got pregnant during the trials, for example, and then we found that they had no complications. And pregnant people have a little higher risk when they get COVID, and the same with immune suppressed people. So there's good reason that those people should probably get vaccinated. It's usually said that they should talk it over with their physician so they can understand the pros and cons and make their best choice, but we would encourage it. And then, well, as I was saying, with pregnant people, there were 23 pregnant people in the studies that had no complication from the vaccine.
Good. All right, thank you so much. This question is for Dr. Kepple. So we heard from Andrew Woodruff that the Pfizer vaccine arrived this morning, but Moderna has also arrived today. And so now we have two vaccines. Is there anything between the two of them that would make an individual want to choose one over another if they had that option?
I would take the first one available. They're both messenger RNA vaccines. There's definite advantages to Moderna in the fact that it does not have to be transported at minus 94 degrees Fahrenheit. It's just 4 degrees Fahrenheit. So, or minus 4 degrees Fahrenheit, which just a typical freezer can keep. So thankfully though, just in case people are wondering, the Pfizer vaccine is stable refrigerated for 5 days. And the Moderna vaccine is stable for 30 days being refrigerated. So they both have, particularly Pfizer has this, what they call elaborate cold chain they have to follow, and it's completely monitored so that if there's any fallout from those temperatures, those vaccines are not eligible to be given. So it's great that we have the logistical systems to be able to do that and track that, the electronic devices, surveillance for devices. There's no difference that I can see on side effects. They both require a second dose. So yeah, first one available.
Great, thank you. Okay, Doctor, just kind of a follow-up to that. So there was breaking news this morning about a new strain coming out of the UK, I guess also South Africa. Do you have, as we're talking about vaccines today, any concern that the efficacy for this new strain will be compromised in any way with these vaccines, or will they still be as successful?
Well, the virologists that I'm reading and that are willing to put their opinion out there are thus far saying it's improbable that the mutation would actually make it such that the vaccine didn't work. but there is significant concern that this variant that is more contagious by 70%, which actually has a very high prevalence in London right now, but also other European countries, and as you mentioned, South Africa, that we already have a very contagious virus, and to have it mutate to even become more contagious is concerning. So I'm really hopeful that the virologist and immunologist are right, that the vaccine is going to stop that one in its tracks as well.
Great, thank you. So Dr. Satterfield, if someone has had COVID, should they still get that vaccine? And if so, I've heard that maybe there's a 90-day waiting period. Is that true?
So the waiting period is recommended, and the vaccine is recommended for people that have had COVID before. But right now we're in a shortage situation where we don't have enough to vaccinate all the people that are at high risk. And you know, if you look at the evidence that we all are aware of, it's insanely rare that people get COVID twice. There are a couple of cases out there. So what that shows us is those people that have had COVID actually are quite immune in most cases. So in my opinion, it's going to be best that the vaccines go to the people that have never had COVID, despite what the CDC is saying right now. And we'll use our judgment. And if somebody really wants it who's had COVID, I think they definitely could have it. But I think it would be better given to someone who's not had COVID yet.
Okay, and kind of a follow-up to that. Do you see this as being an annual vaccine, or have you heard any documentation as to what's being expected?
So we think, based upon the virology, that COVID is more like measles, which does not require any kind of booster, and less like influenza, which we all know has to have a booster shot every year. The virologists think that it is likely there will not have to be boosters, but that really remains to be seen, and we'll adjust as time goes on.
Thank you. Okay, thank you both so much for your time. This is going to be my final question, unless there's anything else that you want to add. But you know, some people have trouble with just vaccines in general.
Mm-hmm.
So Dr. Kepple, can you tell me why you have confidence in vaccines, and had you had any personal experience with regard to them that makes you so confident?
Sure, yeah. Well, for one, I can make a prediction that whenever you're doing millions and millions of something, we're going to see all kinds of things surface. And probably the most common thing that will be out there is when you're getting a vaccine like Dr. Satterfield and I are today, and let's just say we got exposed to COVID 2 days ago, and we're in the incubation period, and we have no idea that we're infected and we're not symptomatic, and we get COVID 2 or 3 days from now, it's very, very common to think that the vaccine gave you COVID when you get sick like that in that time frame. And this is one of the problems that we have with childhood vaccines and things like the alleged autism connection, is that's about the time when autism begins to develop. So when you're doing millions and millions of something, just statistically, there are going to be lots of people who get COVID right after the immunization. And we may actually see, after millions and millions of vaccinations, some rare and possibly even deadly side effects. We don't know. But when you compare that to the 1.7 million people that have died thus far, the United States, again, 3,000 people a day, the leading cause of death, there are some things that we take a step of faith. It is not blind faith. So I've been studying vaccines, and especially just the history of medicine is so fascinating to be able to bring us to a point where now when we live and have children, we don't expect our children to die of a deadly disease because of diphtheria, pertussis, tetanus, measles, mumps, rubella, cholera, all of these people that have gone before working incredibly diligently, polio. So all the way back from 1796 when Dr. Edward Jenner gave the first cowpox vaccine. Smallpox was devastating the world, and now it's virtually eradicated. To 1955, the Salk vaccine and polio. Polio is extremely rare. In my lifetime, I was born in 1962, we've seen things like measles, mumps, rubella, rabies. A big one for me that happened even during my medical career was meningococcus vaccine, where I used to see in my early career in medical school and residency bacterial meningitis, a very, very serious infection that killed young people. And we don't really see that anymore since the vaccine was really starting to be pushed at age 12 back in about 2005. Another one, Haemophilus influenza, which causes epiglottitis, which is a horrible way to die where you can't breathe because your windpipe closes up in children. We don't, with a Hib vaccine, we really don't see epiglottitis much at all. So that's even in my lifetime to feel so safe. Now this vaccine is primarily for our elder population and those with underlying conditions. That's more similar to something like Pneumovax, which is for strep pneumo, which is markedly reduced community-acquired pneumonia. So I've seen vaccines work. There's a Dr. Stanley Plotkin. He was involved in developing multiple vaccines in the 60s. He's now 88 years old. I love what he said about public health. The three biggest things we've done for public health is, number one, clean water. Number two, the advent of antibiotics when used appropriately. And number three, vaccines.
I want to thank you all for your time today. It really means a lot that you would take the time to share what you know about this vaccine. But now we've done all the talking and we've answered all the questions. So it's time for you two to roll up your shirt sleeves and let's get our vaccine.